The purpose of quantitative research studies is to determine what is known. Quantitative research uses measurement to determine the effectiveness of interventions and to report the findings with a level of confidence. It involves the measurement of variables of interest and statistical analysis of the data. These studies are designed to provide high levels of control in that there is a higher confidence in the results. Quantitative analysis can be used to determine the effects of an intervention, measure the relationships between variables, and detect changes over time. These studies provide some of the strongest evidence for nursing practice because they are so highly controlled. Before being utilized and put into practice, research studies must be critically evaluated to assess their credibility. This presentation evaluates the study, The Impact of a Brief Lifestyle Intervention Delivered by Generalist Community Nurses by Harris et al., published in BMC Public Health in 2013. The credibility of a research study focuses on the article's journal, authors, and publication process. Hauser's nursing research textbook proposes a checklist for evaluating the credibility of a research article, and the criteria are: the authors have the appropriate clinical and educational credentials for the study, there is no evidence of conflict of interest for the authors that might introduce bias, there is evidence that the journal is peer-reviewed, the publication has no financial connection to results from the study, and the study has been published within a reasonable time frame. All of the authors in Harris et al.'s research study have appropriate clinical and educational criteria, and they state that the authors declare that they have no competing interest in the conduct of this study. The journal is BMC Public Health, which is an open-access, peer-reviewed journal who would have no financial interest in the positive or negative results of this study, and the study was published in April of 2013 after it had been submitted in September of 2012, which is a reasonable amount of time. Per this criteria, the study seems to be a credible source for information. Research problem statements are declarations of disparity or the difference between what is known and what needs to be known about a topic. They define the areas of concern and focus the research methods. It can be directly stated or inferred. Hauser proposes a checklist for evaluating problem statements, and the criteria are as follows. There is deductive narrowing from the general to the specific. The problem is stated or inferred. The statement is provided early in the article and is easy to find. The concern or disparity is clear. It is significant because it develops, expands, or validates nursing knowledge, conceptual models, or theoretical frameworks, and it improves patient care or staff member and/or organizational processes or outcomes. Harris et al. Offer an effective problem statement in the background section of their article when they state, "Our previous research has shown that community health nurses consider the provision of lifestyle intervention appropriate to their role, and it is well accepted by the clients. However, few studies have evaluated the effectiveness of lifestyle interventions provided by community nurses in routine practice." That problem statement is inferred early in the article. It narrows from a generalized topic to a specific topic in which the disparity they seek to research is clear, and it is significant to the field because it will expand the theoretical framework of community nurses and improve patient care. Choosing an appropriate research design is crucial to the credibility of a study because it must fit the research and purpose statements to best answer the question that is being asked or evaluated. Quantitative designs measure the effect of an intervention, test the theory about relationships, or describe a phenomenon with precision. Hauser proposes a checklist for the evaluation of a research article design, and the criteria are as follows. The design is clearly identified and described. A rationale for the choice of design is provided or can be inferred. The characteristics of the design can be clearly linked to the nature of the research question. The variables are explicitly identified and definitions provided. Enough detail is provided that an informed reader could replicate the study. And the researcher has documented the basis for decisions as the design emerged. Harris et al. Use a quasi-experimental design in their research. Quasi-experimental designs often involve studying intact groups. In this case, 4 generalist community nursing services were used. 2 services were put in an early intervention group and the other 2 in a later intervention group. This research design is appropriate because it is clearly identified and described. The rationale for choosing the quasi-experimental design is easily inferred. The characteristics of the design and study are clearly linked to the research question, and the variables are identified and defined with enough detail that someone else could replicate this design and study. Ethics is the study of right and wrong. Ethical considerations tell how one should conduct research and is guided by the researcher's integrity. There are also legal guidelines in place to maintain ethics when human subjects are used in research studies. Caution must be taken to be sure when selecting participants, collecting data, and reporting findings to be sure that the researchers are not holding a bias and that risk of harm to the human subjects is reduced. In the study by Harris et al., care has been taken to reduce any ethical issues. The research study was approved by the Hunter New England Human Research Ethics Committee, with reference number provided, and ratified by the University of New South Wales Human Research Ethics Committee, and the Human Research Ethics Committees in each of the participating area health services. The study was conducted in compliance with this committee's regulations and the Helsinki Declaration, and all participants provided informed written consent for publication of findings from the research. The identities of all participants in the study have been carefully guarded so as to not show bias to demographics and to protect under privacy law. The purpose statement of a research study is a declaration of intent. The purpose statement in the study by Harris et al. States, "The aim of this study was to evaluate the impact of a brief lifestyle intervention delivered by community health nurses as part of their routine practice on changes in clients' smoking, nutrition, alcohol, physical activity, and weight, or SNAPW, risk factors." Hauser proposes a checklist for critically evaluating purpose statements within research studies. Well-written purpose statements are narrowed from the problem statement, are written as a statement rather than an opinion, use an unbiased verb, and define the population to be studied. Harris et al. Utilize these criteria in their purpose statement. The purpose statement is clearly narrowed from the problem statement, which was discussed earlier. It is written as a statement rather than an opinion. It uses an unbiased verb, evaluate, rather than a biased verb such as prove or solve. And it defines the population to be studied, which is the clients of community health nurses after a lifestyle intervention is delivered. The literature review section of a research study provides information about the study's context in the field, its potential for use in practice, and support the author's conviction that the study has implications for practice. Hauser poses a checklist for evaluating the literature review in a research study, and the components are as follows. The review relies primarily on studies conducted within the last 5 years. The research study's relation to the previous research proposed in the literature review is clear. The theoretical or conceptual framework of the studies is described. The literature review provides support for the importance of the study. The review is unbiased and includes both conclusive findings and findings with inconsistencies. The author's opinion is largely undetectable within the literature review, and the review ends with a summary of the most important knowledge on the topic. Although the article does not have a specific literature review section in the study by Harris et al., the literature posed in the background section and throughout the analysis of the research meets all of the topics for a well-done literature review. The article provides a multitude of recent studies published by the SNAPW risk factors and their link to diseases and death in Australia, along with how primary health and generalist community nurses play a role in promoting healthy lifestyles, showing that the topic of this study is relevant. The review is unbiased and contains some studies showing inconclusive results, further demonstrating the need for further research. The review is not opinionated, and there is a summary of the findings within the literature discussed. A research study's sampling strategy is crucial to ensure the study findings are complete and applicable, and there are many ways to ensure bias is reduced. Hauser again proposes a checklist for evaluating the sampling strategy within a research study. The target population must be clearly and objectively identified. Inclusion criteria is specific and relevant to the study. Exclusion criteria is specified to control possible variables. The potential for sampling bias is controlled by the researcher. The sampling procedures used are likely to produce the best informants for the topic, and the sampling is unaffected by homogeneity or non-response. The sampling data within the study by Harris et al. Is adequate to achieve statistical significance. The target population is clearly identified and inclusion criteria explained as clients age 30 to 80 years, able to read and understand English at an appropriate level, enabling them to properly participate in a survey, who were referred to community nursing services. Exclusion criteria is much more specific to rule out the possibility of variables affecting the study and data. There is no demographic or other bias evident in the sampling, and the sampling was diverse and unaffected by non-response. The measurement or instrumentation portion of a research article summarizes the concepts that were the focus of measurement and the tools or instruments used. Hauser proposes a checklist for evaluating the measurement strategy within a research study, and the criteria are as follows. The instruments are clearly linked to concepts in the research question. The instruments and measures are described objectively. The reliability and the validity of the instrumentation are described and accompanied by supporting statistics, and a detailed protocol for the use of each instrument in the measurement is described. The description of measurement and instrumentation, or in this case intervention, by Harris et al. Is very thorough. The article describes the multiple interventions used, which include the service level intervention, in which university staff trained the community nurses participating in how to integrate screening tools and guidelines for the lifestyle interventions, and the client level intervention, which was then provided to clients by the participating nurses. The instruments and interventions were linked to the research question and are described objectively and in an unbiased manner, supported by statistics in how they will be useful and measurable in the study, and protocol is provided for the use of each of the interventions and instrumentation. Overall, this study by Harris et al. Is a well-written, credible source that can be utilized to further nursing practice. Evidence-based practice, or EBP, is defined as integration of the best research evidence with clinical expertise and patient values. EBP is used to standardize healthcare practices, which reduces undue variation in care, in turn leading to better and more consistent patient outcomes. Utilizing EBP has been crucial in closing the quality chasm, as distinguished by multiple Institute of Medicine reports since 2001. To be able to find and utilize EBP for best patient outcomes, practices and procedures must be researched, and those research studies must then be critically evaluated for credibility, such as what was done here. This study by Harris et al. Provides good, credible information for EBP. The study demonstrated that an intervention to provide training, resources, and support to community nurses was associated with increases in referrals for and advice given to clients with SNAPW risk factors. In addition, advice and referrals were related to some improvement in client self-reported readiness for physical activity. However, there were no reported changes in lifestyle behaviors or weight. The contribution to EBP, then, is that providing tools for nurses to effectively screen clients for risk factors subsequently leads to advising those clients properly to help reduce the risk of chronic illnesses in the community health setting. Also, increased advice and referrals for clients at risk leads to some improvement in client readiness for physical activity, which is a notion that nurses everywhere can utilize. The study also contributes to EBP with what it did not find. Simple advice by community nurses did not achieve any lifestyle behavior changes or changes in weight. Using this evidence, nurses can realize the need to facilitate further referrals to more intensive research interventions, such as with physicians and specialists involved in continued long-term care.